when you think about the global scale, what is interesting is that the solutions, like you mentioned, are going to be different, but some of the problems are actually the same. They may not be to the same scale, they may not be in the exact same way, but many of the general problems and the challenges that we have in healthcare are going to be the same. So, one is, how do you actually give every person in your population access to healthcare, right? Some people have the problem that even in a city, people can't reach a certain destination due to bad transportation or traffic. And in other places, it could be rural and geographical. Second, we're seeing that, we have the same diseases, chronic diseases are growing because as the population is aging almost across the world, we're seeing a different change in the types of diseases we're finding. And so some of the ways that we use digital medicine for those can be shared as well. Like, we use a lot of the same medicines, and so it would not be any different to try some of the same programs. The third, like we were talking about, how do you deal with some of these inequities, the social determinants of health, the changes from climate that are creating places and are affecting healthcare dramatically? How do you fix some of those, knowing what we might have done in the same situation or in simultaneous situations? So when you bring up the South Korea story, it's one that the US already had to face, and our solution was paying for. When I think of the EU and I think of the way that they're trying to regulate I think we learn from it. They're trying to do it in a very safe manner, but they're really trying to think it through before they build and then just release it into the market in healthcare. So I think with the advent of the internet and the ability to share and to have these conversations across the globe, like even you and I are having, we find and we're going to be able to talk about some of the barriers and challenges we have and see what other people have done.